Cholecystitis. Oh goodness, your tummy is hurting, is it? My. The good doctor has you bundled up in the hospital and would like to hear a bit about your gallbladder. Yes, that's right, your gallbladder. You see, if you have gallstones and infection of your gallbladder, then you have cholecystitis. Let's look and see. Your gallbladder sits just under the liver and releases a liquid made of cholesterol and salts that is called bile. Bile is stored in your gallbladder and is released into your intestine to help with digestion of fat in meals. Up to 20% of people in the US developed gallstones that develop from bile and cholesterol in bile. Patients who are overweight or eat high-calorie diets are at higher risk for developing gallstones. In some cases, gallstones form and then move into the cystic duct or common bile duct and get stuck. Gallstones may pass on their own or cause a complete blockage that results in inflammation and infection of the gallbladder that can result in significant pain. Many people with gallstones never develop pain. If you have pain related to gallstones, then you are at risk of developing infection of the gallbladder that can become serious. The primary treatment for gallstones causing pain and infection is surgery. That means removal of the gallbladder through a procedure called laparoscopic cholecystectomy. You may ask if there is a way to avoid surgery and to dissolve the gallstones with medications. There is a medication called ursodeoxycholic acid that can help dissolve some gallstones, but it is often not effective. Generally, if you have a gallstone causing pain and infection, and you develop fever and a high white blood cell count, then the best treatment will be surgery. If your symptoms completely resolve and you do not have surgery, then there is a 25% chance that you will have another gallbladder attack within 6 months. There are cases where you can have gallbladder pain without gallstones. The treatment will be the same as for cholecystitis caused by gallstones. The first tests to diagnose gallstones and cholecystitis are ultrasound of the gallbladder and CAT scan of the abdomen. Both tests can help determine if there are gallstones and inflammation of the gallbladder. If you have inflammation seen on ultrasound or CAT scan, and you also have fever or a high white blood cell count, then you will be treated with antibiotics for infection of the gallbladder. Next, you may have a HIDA scan or MRI of the abdomen, called MRCP, to determine whether you have a gallstone that is causing a blockage in the cystic duct or bile duct. In some cases, a stone can get lodged in the common bile duct that can result in jaundice or yellowing of the skin. The stone can get lodged in the parts of the duct near the pancreas and cause pancreatitis that causes severe abdominal pain. If you have a stone in the common bile duct, you will need a procedure called ERCP to remove the stone before going to surgery to have your gallbladder removed. I hope you feel better soon.